Okay, welcome back to our lab series of videos that we're going to continue with. And tonight what we're going to talk about are the articulations or the joints of the body. Now before we even get into all the joints that we need you to know, I want you to write down these three questions because these are the three questions and how we're going to ask them on tests for both lab and lecture. So the first question that we could possibly ask is, name or classify this joint according to movement. The second question will be, name or classify this joint based on structure. And then the third question will be, name this specific joint. So if we go back up to name or classify this joint based on degree of motion, there's three possible answers that you can have. And those are in bold, and those are the major headings 1, 2, and 3 on your checklist on page 24. So you have a synarthrosis, and that's a joint that allows for no movement. The second type of joint is an ampiarthrosis, which means there's slight movement permitted between the bones. And then finally, number 3 would be your diarthrosis or diarthrotic joints, and those are freely movable joints. So again, name or classify this joint based on degree of motion. You only have 3 possible answers: synarthrosis, an ampiarthrosis, or diarthrosis. The second question that we can ask, name or classify this joint based on degree of movement. Again, you only have 3 possible answers, and those 3 possible answers would be: number 1, a fibrous joint; number 2, a cartilaginous joint; number 3, a synovial joint. And what's that telling us when we talk about structure is, what is the tissue that is in between the bones? What tissue is remaining in between the bones? So obviously a fibrous joint, there's a fibrous connective tissue that's found between the bones. A cartilaginous joint is referring to that there's cartilage between those joint surfaces. And then number 3, synovial joint, would be there's a synovial membrane in there, in between the bones. Now the main thing to remember, and this is a big key, and it's right there on your checklist, but all the diarthrotic joints structurally are synovial joints. And then we go down the checklist, the specific joints: suture, synchondrosis, gomphosis, symphysis, syndesmosis, ball and socket, ellipsoidal, gliding, hinge, pivot joint, and a saddle joint. Okay, so here what we're going to do now in this little lab presentation is we are going to go right down the specific types of joints. Now the first one underneath the synarthrotic joint is a suture, and we have showed you the sutures already, but we are going to come back again. Again, the sutures are the joints that are found on the skull that keeps the skull bones together. And so when we come here, again, on our sagittal suture, remember the sagittal suture is what separates the 2 parietal bones from one another. The specific joint would be the sagittal suture. If we asked you a question on classify this joint based off a structure, that would be a fibrous joint. And then if we said classify this joint based on degree of movement, that would be a synarthrosis. So again, a sagittal suture separates the left from right parietal bones from one another. The coronal suture runs right across the top of the skull like this, and it separates our frontal bone from the 2 parietal bones. The squamosal suture, which is on the lateral side of the skull, runs right around the temporal bone right here, and that separates the temporal bone from the parietal bone. And last but not least, the lambdoidal suture is this joint right here, and the lambdoidal suture separates our occipital bone from the 2 parietal bones. Now we're going to drop down to the synchondrosis type of joints that we find in our body, are the ones that we're going to make you responsible for. So the first, and again, a synchondrosis, if we was to say name this specific type of joint, it would be a synchondrosis. And then as you can see in parentheses there, structurally, a synchondrosis joint is a cartilaginous joint because there is cartilage between the joint surfaces of the bone. So when you are looking at the examples, the epiphyseal disc of growing bones, we'll discuss that more in lecture. We're not going to hold you responsible for that for a picture of what it looks like for lab purposes. So you don't have to worry about that. It's just basically what the epiphyseal disc is. That is the growth plate when our bones are growing. And then the another example of a synchondrosis joint is the articulation between the first rib and sternum, which we have right here. So as we come down, there's the clavicle again, but if we come right here, here is the first rib coming in right here, and we see it articulate with the sternum right here, more specifically the manubrium of the sternum. And we can see that there's a piece of cartilage running between those two bones. So that is why structurally this is a cartilaginous joint, but again, there is no motion at that joint, so classify this joint based on degree of motion, it would be a synarthrosis. And then finally, the last type of synarthrotic joint that we can find in our body is a gomphosis. Specifically a gomphosis, and again, classify this joint based on structure. It would be a fibrous joint, again, because there is a fibrous connective tissue between the joint surfaces. Now, we have to say that this is going to be a little different because we're not going to have a bone on one side, but where we find our gomphosis is at, our gomphosis are these joints that are formed between the maxillary bone and the mandible along with the teeth. So when the teeth fit into the alveolar processes, we technically consider that to be a joint. So again, we could tag something like this right here and say, classify this joint based on degree of motion, synarthrosis. Classify this joint based on degree of movement. Oh, that'd be a synarthrosis again. I was trying to trick you. Classify this joint based off of structure. It would be fibrous joint, and then name this specific joint, and it would be a gomphosis. Okay, now we're going to move into the ampiarthrotic joints. Again, these are the joints that allow for slight motion between the bony surfaces. And again, this would be classify this joint based on degree of motion, ampiarthrosis. Now, the first one underneath your checklist, this specific type, is a symphysis. And we find two examples of a symphysis in two locations in our body. The first one would be the intervertebral discs. So right here are the vertebra, and then here is this structure running right between the vertebra, and that is the intervertebral disc. Now again, we've all heard of someone talking about having a herniated or a bulging disc. These are the structures that go bad, that lead to a herniated or a bulging disc. But between these two bones right here, this forms the joint right here. So classify this joint based off of structure, cartilaginous, name the specific type of joint, symphysis. Another example of a symphysis joint is right here between the two pelvic bones anteriorly, and this is referred to as the pubic symphysis. Again, so you can see there's the cartilage that's running in between it. So again, classify this joint based on structure, cartilaginous. Classify this joint based on degree of movement, ampiarthrosis. Name this specific type of joint, symphysis. We don't have to get crazy with pubic symphysis or intervertebral discs. Just keep it real simple, folks. Now we're going to move on down to the second type of specific joint listed underneath an ampiarthrosis, and that would be a syndesmosis. So again, and you can see what type of joint structurally is a syndesmosis. It's a fibrous joint. And two of the best examples that we have in our body are, number one, are the fontanelles in the fetal skull. And we're going to show those to you right now. So here's the fetal skull right here. So when we look right here at the very top of the right at the very top of the skull right here, we see this somewhat of a rhomboid structure at the very top of the head. This would be the fontanelle right here. More specifically, that would be the anterior fontanelle. And again, this would be the baby's soft spot on the top of the head. Then we come back here, here's the posterior fontanelle right here, this little triangular shaped structure. And again, that is an example of a syndesmosis joint. So again, if we were to look at it, what is this tissue right here? This is that fibrous connective tissue that's lying between the bones. And then another example of a syndesmosis joint is the interosseous ligament between the radius and the ulna. So here is the distal end of the ulna and radius, but as we look through here, we see this membrane that runs between the two bones right here. And this right here is the interosseous membrane, but that helps form a joint between the ulna and the radius. Now we're going to move into our diarthrosis joints, or our diarthrotic joints. And again, remember, all of your diarthrotic joints, folks, when we ask you anything about structure, they are all synovial joints, which means they have synovial membrane lining the joint surfaces. And again, the synovial membrane is there to produce a synovial fluid, which helps lubricate the joint surfaces. And that's why it's so important that in all of our freely movable joints, we have that synovial membrane to really reduce friction, because the joint surfaces are really moving a great distance on one another as compared to the other two types of classifications of joints. The first one is the ball and socket joint. That's a specific type of a diarthrotic joint, ball and socket. And the two best examples would be the hip and the shoulder. So when we look right here, we grab the pelvis, and again, remember, what is that large depression on the pelvic bone? Okay, you've had enough time to know and answer. That would be the acetabulum. And then we have the femoral head here. So that would be the ball component of the ball and socket joint. The acetabulum would be the socket. So we fit that joint right with the femoral head into the acetabulum, and that forms your ball and socket joint. And again, on the shoulder, we have our scapula. And again, what is that circular region right there? I'll give you a 3, 2, 1. You guessed it. You guys are good. That would be the glenoid cavity. And then again, that's the socket component. And then here is the humerus right here. Here's the humeral head. And we see that the humeral head fits right into the glenoid cavity. And that is where our shoulder or arm motion comes from. Okay, now we're going to be moving into the ellipsoidal or the condyloid joints. And the only ones that you are responsible for, the ones that are listed right there in your checklist. So if you read the checklist, it's the joints between the 2nd through 5th metacarpals and the proximal phalanges. So again, if we're looking at the hand, how do I know that this is my thumb? Well, I can only count 2 phalanges. So there's only 2 phalanges in my thumb. So this would be fingers 2, 3, 4, and 5. So these joints that are running right here, those are an ellipsoidal or a condyloid joint. And then last but not least, the ellipsoidal joint is at the distal end of the radius and between the proximal or carpal bones. So this joint right here at my fingertip, that is all an ellipsoidal joint. Okay. Then the gliding joints, folks, the gliding joints, the only ones that Mr. Fogel and I are going to have you be responsible for the gliding joints are the intercarpal and intertarsal joints. So you can cross off the joints between the superior and inferior articular facets, the sternoclavicular joint, the acromioclavicular joint. We don't need you to worry about those. So if we come in here, if we go anywhere in between the carpal bones right here, between the carpal bones themselves, These are examples of gliding joints. Now, this is a good time to talk about this real quick because we do talk about freely movable joints. So a lot of times in A&P, people think, oh, real large motions with the freely movable joint. And that's not the case because we're not going to get real large motion between these joints. But we can get in there and we can move those joints along one another, those bones along one another freely without hindrance. And that's what we're talking about. So again, we need you to get away from the idea that freely movable means large movement. It just means that the surfaces are able to move on one another without hindrance. And so that's the intercarpal bone. And then again, these joints right in here between all of the tarsal bones, those are all gliding joints. And again, structurally, what type of joint are they? They are synovial joints. How about degree of motion? That would be a diarthrosis. Okay, now we're going to move into our gliding joints, and two of the best examples that we have in our body, actually three examples. We have the joint between the humerus and the ulna. We have the elbow, the knee, and then within our fingers as well, the interphalangeal joints. So a hinge joint, I always just tell people to think about a hinge on a door. What does a door do? It opens and it closes. So in a hinge joint, when we have at the elbow, this would be our elbow locked into extension right here. Then when we move it into flexion. Okay, so that is an example of a hinge joint. So again, simply as you bend your elbow and then straighten it, that is a hinge joint. Same thing with the knee. Think about it. You can basically only straighten and bend your knee. And then if we looked at the fingers, the interphalangeal joints right here, we could come here and bend that down into flexion and move that back up into extension. And you can try that even on yourself. If I just block my finger right here, hold right here, if we just look at the tip of the finger, I can move it into flexion and then move it into extension. Flexion, extension. And again, if we get any other motion at those joints, that's going to hurt. So just keep it to flexion and extension, folks. A hinge joint. We only have two more joints to discuss, and that would be a pivot joint and a saddle joint. So the pivot joint, the two locations that we want you to know, it's the joint that's formed between your atlas and axis of the first two cervical vertebrae. Remember, the atlas is the first cervical vertebra, and the axis is the second cervical vertebra. And we also want you to make note, the only type of motion that is allowed at pivot joints is rotation. So if we have our atlas right here, and then there's our axis, when this joint moves, what happens is we get rotation around the axis. Okay? So this is equivalent to shaking your head no. Are you guys having fun taking A&P this summer? No. Where did that motion occur at? It occurred between the atlas and the axis. So this joint right here, the joint that's between your atlas and axis, that is a pivot joint. And another example where we can find a pivot joint in our body is between the ulna and the radius. So this joint right here, and obviously with the metal here, we can't move it like we want it to. But if we were to rotate, the radial head will rotate on the ulna. So basically what will happen, folks, this is what the motion is, what will happen when we're in anatomical position, our forearm is what we call in supination. That's the motion, supination. Now, when that motion occurs at this joint, what we can do is we can rotate the palm of the hand posteriorly, and that's called pronation. So supination, the palm of the hand faces forward. Pronation, the palm of the hand faces posteriorly. Again, those are motions that occur. Now, again, easy way to remember that, folks. How do you carry a bowl of soup? You will better be carrying it in supination with the palm facing anteriorly. Because if you carry a bowl of soup in pronation, you're gonna go hungry and have something to clean up afterwards. So that's are your pivot joints. And again, the big key is, folks, pivot joints only allow for rotation. And then finally, we're gonna come to our last joint, and that would be the saddle joint. We only have two saddle joints in our body, one on the right, one on the left, and that is gonna be between the first metacarpal and the trapezium, okay? And it's this joint right here. So there's the first metacarpal, there's the trapezium, this joint right there, that is the saddle joint. And again, what that does is that allows us to do one important thing that no other creature in the world can do who has 5 digits, and that is opposition. Opposition allows us to take our thumb and touch every one of our other fingers. And why do we have that? It's due to this joint right here, the saddle joint.